everyone, Terry Maxiner here with Bridging the Gap of Care. These are senior resources you need to know as you are facing the reality of aging or your older loved one is facing the reality of aging. And on these video podcasts, and I can also say today we are Facebook Live, I get to bring you some wonderful resources. I've got guests here who are experts in their field. And as them being experts in their field, get to bring you some information and resources that typically probably you don't know about. As I myself have getting a large learning curve, is I'm learning about more of these resources out there. We're going to be focusing today with the senior population and kind of looking at dementia, anxiety, isolation, and some of those things that go along with that. So I have a definite expert with me today as my guest, and that's Stacey Schulte. And Stacey is a nurse practitioner in older adult practice with older adults, with also a background in dealing with folks with psychiatric issues as well. And we know as the dementia group is growing and growing, someone is being diagnosed every 67 seconds, we know that there is other symptomology that is usually happening with these folks that we don't know about. So I welcome Stacey. Thank you so much for being a part of our show.
Thank you for having me.
You are very, very welcome. So Stacey, I think too, as we're looking at the elder population and the dementia numbers growing, I have seen, at least in my practice, when people have reached out to me, they're seeing a big sign of depression. So I guess my question is to you, what are some of those early signs that I can look for?
Well, a lot of the early signs that you see with the depression and with the dementia is that people are very uninterested in social activities, being around other people.
Okay.
It's some basics that normal depression does.
Okay.
Lack of interest. But also, too, it's just really pulling away, becoming angry. There's behaviors at times. You can get some anger issues. Anxiety is a big one that comes out. Sometimes there's different types of issues with sleep.
Okay.
More sleep. Not wanting to get out of bed. I'll just stay here all day. Not wanting to get out of the chair. Not wanting to interact.
Okay. So I guess, I'm hearing too from you, as well as I'm kind of identifying that mom maybe isn't wanting to get out of the house, doesn't want to do the things that she used to like to do, and also too the sleep patterns, and I think that can be such a huge issue. I guess what I'm looking for answers to, because I know people have asked me this, when is it an issue? When should I seek some help with them?
Well, it becomes an issue when people are not taking care of themselves.
Okay.
Or they are becoming so socially withdrawn that you're not seeing them anymore.
Okay.
Or they're really, really pushing people away.
Okay.
The diagnosis in and of itself, a lot of times dementia sets in 10 years before it's officially diagnosed.
Correct, yep.
So, and once you get a diagnosis or people are starting to suspect dementia or saying, Mom, you're getting senile, that in and of itself causes depression.
I know if I got that diagnosis, and because at this point, when I've been diagnosed with maybe a cardiac issue or a cancer, they give me the next steps.
Yes.
I get diagnosed with some form of dementia or Alzheimer's disease, it's like, here's a list of caregivers, and the 1-800 number, and the Alzheimer's Association.org. So I think that was so great that you brought that up. So would I start with my primary care physician?
Absolutely. You'd start with your primary care physician. A lot of primary care physicians, we all this day and age have to be versed with older people, older
Excellent
adults.
to know.
And if they're not, then they will more than likely refer you off to a geriatric psychiatrist.
Okay. And that's probably the practitioner that could give me that definitive diagnosis.
Well, the more the definitive diagnosis comes from neuropsych testing.
Okay, good to know.
Okay, so sometimes when you're looking at people and you're trying to figure out, do they have depression, do they have dementia or not, going through neuropsych testing will give you that definitive answer.
Okay.
The catch with that, though, is that there's definite things. If you suspect that there is a diagnosis of dementia and that it's early on, to have somebody labeled competent or incompetent by this.
Okay, it's just a whole ball game right there.
It's a whole different ball game.
Yes.
However, it does definitely give people answers. And so what I do suggest people do is, talk to your loved one, see what their wants and wishes are, make sure that you have financials in order, make sure that you have power of attorney, both medical and, like I said, financial, power of attorney in order, and then get the neuropsych testing so that you can see exactly what's going on and what stage of the game that you're in.
Exactly. So yeah, just kind of reviewing with our audience, just, the game plan and the map for you is to have those things in order, because if there is made that level of competency and my older adult loved one is not competent, it's no time to change anything. They can't.
No.
So I love that advice that you had said for our audience especially. Get that, your plans in order. Visit with that elder care attorney, preferably a CELA, a certified elder law attorney. Get all that paperwork in order, because again, as we're mapping out that diagnosis and what the care plan needs are, there can be some costs involved, whether or not I'm going to choose to have support at home for my loved one, or I'm going to choose to have them in a memory-supported assisted living,
Yes.
Which can be very expensive. So I think, too, the other thing that I just want to touch on a little bit is we're seeing a real rise, at least in the articles that I'm reading about, with abuse, whether it's alcohol or drug abuse in the older population.
So the older population is really no different than the younger population. People like to have their glass of wine at night or have their glass of scotch at night, and that's, for most people, a glass is okay.
Right.
However, there still are, grandma and grandpa can still be addicted to alcohol.
Exactly.
The other thing that I have found too is that people, unfortunately, have multiple comorbidities, including arthritis or pain of any kind.
Right.
And they have become addicted to narcotics.
Okay, yes.
And so that definitely, both of those issues can play into your cognition and mimic dementia in some cases.
Absolutely, you're right.
Or worsen it.
Exactly. So I think, too, as the adult children, kind of keeping that eye on them, as far as, of course, mom and dad probably want to hide that as much as they can.
Absolutely.
But again, because there's probably more behind the scenes. Why is that increase in alcohol? Why is the increase in pain medication? And I imagine just the fears and anxieties of, one, just the natural aging process.
Absolutely.
And then, two, having that diagnosis of dementia. So just, kind of wrapping up for our audience, you had stated, and I think it's great, start with your general practitioner first, because I know there's some diseases that can kind of mimic dementia.
Yes, there's definitely, when you look at Parkinson's, they can have some issues with dementia, and there is a Parkinson's-related dementia, but also there is normal pressure hydrocephalus.
Okay.
That is very treatable and can reverse some of the signs and symptoms of the dementia symptoms that the patient may experience. There is that would be getting a neurologist involved. There are procedures involved in that. Not everybody qualifies for the procedure with normal pressure hydrocephalus. However, it is something that can be reversed. And it's one of the few types of dementia with symptoms that can actually see some reversal.
That is, so everyone where I'm all of a sudden writing mom or dad off, it's Alzheimer's. It really is. I know for sure it may not be.
It may not be.
We've even seen urinary tract infections that can make people kind of change their moods and their behavior, and it's something so treatable.
Well, in the population, once you hit 60 and above, once a patient gets a urinary tract infection, when we're younger, we experience all the normal symptoms. You get burning, you're not feeling good, you've had a urinary tract infection. Those symptoms go away. And so the way that we see patients come in is, mom all of a sudden got really, really confused, and it was all of a sudden. Okay. Or mom is hallucinating and seeing puppies in the room or small children in the room, and we're not sure what's going on. First things I've done as a clinician is to look at the blood and to do a urinalysis and to see what is going on. And once you treat the urinary tract infection, you will see a difference in mom.
Isn't it amazing? It is amazing. So I think, audience, as we're seeing here today with my interview with Stacey Schulte, is that we really have to be cognizant. If there are some quick onsets of some symptoms with our older adult, get them to their primary care physician. Start with the basics, like Stacey had said, blood work, urine analysis, maybe a cardiac workup or something like that. And then there is next steps that you can do if we look like it's going to be some type of dementia diagnosis. So I thank my audience, and I thank Stacey for being with me today. Again, we're just bringing you more information that you need to know. So thank you for joining us for Bridging the Gap of Care.